It's a very difficult question to answer, whether a lady should have a mammogram on a regular basis and at what age one should start. I think the most important thing here is that every lady should make the decision for herself, because there are certainly significant benefits to be had from a mammogram, but as well there are downsides. Perhaps I will talk to you a little bit about the downsides first, and then explain that the benefits are thought by, again, most experts to far outweigh the downsides. So what are the downsides? Well, we've mentioned before that a mammogram is uncomfortable. We've mentioned that there is a small amount of radiation involved. However, recently, a lot of attention has focused on the problems of any test, but particularly with a mammogram, where one can get an answer to the mammogram which suggests that there might be something worrying. Probably not, but we need to do further tests. That might involve another X-ray, it might involve an ultrasound scan, or even a biopsy. And in the end, the abnormality is thought to be not at all worrying. So you could say that you had all those tests unnecessarily. And that certainly is a drawback to any test, but particularly a mammogram, where in a certain small percentage of ladies you have a mammogram and you're called back for further tests just to clarify a potential problem. The further problem that has been highlighted recently is the issue of overtreatment. Now, over the years, the quality of mammograms, of breast x-rays, has significantly improved, and we're now able to pick up problems in the breast, such as precancer and true cancer, at the very earliest stage. Now, on the one hand, that's an extremely good thing, but experts, epidemiologists have raised the issue that it may be that we're picking up these problems at such an early stage that even if left untreated, they would not cause any serious problems to that particular lady. So you could say, and it has been raised as an issue, that many ladies are treated unnecessarily for breast cancer when they didn't need any treatment. Of course, the other side of the coin is that far more ladies have breast cancer picked up at a very early stage that would eventually cause serious problems and even their death. The statistics are something like between 10 and 20% of very early breast cancers may not be lethal. But as you can see, maybe 80 or 90% would be. And therefore, although there certainly will be a certain number of ladies who might be treated unnecessarily, the vast, vast majority will be treated for good reason.